Good afternoon. Welcome. Glad to have you with us today. My name is Lauren McMeekin. I am waiting on Kelly Frankie, and we will be talking about the difference between OCD and obsessive-compulsive personality disorder today on this episode of Purely OCD. So welcome. And if you have any questions about OCD and obsessive-compulsive personality disorder, we're happy to address those. If you could just throw the question into the little question mark box. I see that Kelly has joined us. Hold on just a moment. Oh. Let's see. I just requested her, but I think she requested me too. Oh, there we are. Can you hear me? Oh, wait, hold on.
Oh, can you hear me?
I can. I didn't have my headset plugged in all the way. Minor details.
Okay, so my head's cut off. That's cool.
Here, off head. We'll call it cut off head syndrome, COHS.
Well, I have such a large desk, meaning like the depth of it is very. I moved people. I'm in my office. I've taken it back.
You're back. You're taking over the office again. I like my head's a lot bigger than yours in the scheme of things.
Well, because I'm way.
I'm like, hold on. I'm gonna move back now. See, 'cause there you go.
But here's the downside: is that I can't read anything because I don't have my faraway glasses on.
Well, the good news is I can.
Okay, good.
So we'll deal with it. We'll go with it. How are you, friend?
I'm okay. I'm don't like change, so this is uncomfortable for me.
You're like, why are you so far away?
Like first world problems. You know
Yeah,
what I mean?
totally.
But I
Yep.
have I'm uncomfortable with change. That's all. It's
Yeah.
really that simple.
Yeah. I feel you. I feel you. I'm not great with it myself, but I'm okay with your change today. It's not bothering me.
Okay.
I just wanted to let you know that because obviously.
Perfect.
Anywho, so
Anyways.
OCD versus OCPD is our topic of discussion today, and we can open up for Q&A after a brief dialogue about it. I actually pulled up the DSM criteria for OCPD if we wanted to, if you wanted to talk about it.
Yeah, if we want to really pull it apart.
Really tear it apart or not, whatever works.
So quick question.
Yep.
With Instagram, it keeps going like it's like my phone's going to shut off. What is that? That's new.
Oh no, like you have to keep tapping it?
Yeah.
Is it because your battery's low?
No, it's fully charged.
I got nothing.
Son of a
Sorry.
mother. Okay.
Sorry, your tech support is out of ideas.
Okay. Well, it's okay. So we'll see what happens. If I keep touching you guys, it's just because I don't want my screen to go black.
Well, totally understood. I've had to do it before when my phone battery died because my phone battery is often dying. It is not today.
Oh no. Okay.
Oh, it's like every few seconds. This is
Yeah.
gonna be fun. Strap in. It's from brightness and settings. Okay.
Oh, like the brightness is too low?
Maybe. I don't know.
Okay, hold on.
You can set it to stay on longer, she says. This person says, rather, not she. Kelly seems to have disappeared. So, can you hear us? There you are.
Yeah, let's see if it works.
Fingers crossed.
I made the brightness brighter.
Okay. I dig it. I dig it, dude.
Sorry, guys. We're going to get to the topic at some point, I assure you.
Stay on the rails, okay? Just stay on the rails, Toodle.
I forgot to put deodorant on right now, and that's also bothering me. It's throwing off my whole game, you guys.
Dude, you know that's like my specialty. I never forget. I never remember to put on deodorant, and you always have to let me borrow some.
I know. And I always got it on me. So,
thank God.
What's that say? Just saying.
It's cool. It's cool.
Anyways.
So OCD versus OCPD.
Mm-hmm.
Bullet points.
Bullet points.
Bullet point 1. My favorite. I feel like this is the largest bullet point probably, but ego syntonic versus ego dystonic is what I think of when I think of OCD versus OCPD.
Right. So ego
So
syntonic. Yeah, go ahead.
yeah, here. Why don't you tell the crowd what ego syntonic means,
All right,
Kelly?
crowd. Ego syntonic is when let's say like the intrusive thoughts are aligned with your values, with your
Yeah.
identity. So for example, somebody who is having thoughts about harming somebody, they aren't, if it's ego syntonic, meaning it's like the same, it's aligned with who they aren't bothered by them. They're not seeking help. They're like, yes, I'm so pumped about this. They're not even trying to figure out whether or not that thought is bothering them. They're not like, but do I like it or do, no. They're like, yes, I cannot wait to execute my plan. And we'll fantasize about it. They're not coming in our office.
Right. Because they don't want to tell anyone because they want to get away with it.
Right.
At the risk of being totally reassuring. So, but here's the thing. So with obsessive compulsive personality disorder, people aren't like pumped about killing people, just to be clear. But that's the difference between.
Well,
I mean, maybe
that's where
they
I was
are.
going to hand over the baton, my friend.
No, I know, but it was a good setup, dude.
Yeah. It was.
Is that like ego syntonic, this idea of having thoughts that are aligned with what you really want, with your values, with who you are. That with obsessive compulsive personality disorder, a lot of it is about rule following, about there's a rigidity to it, perfectionism, an unwillingness to let go of control, especially in work settings. Like I said, from that sort of perfectionistic standpoint. And while people with OCD might feel compelled to do things in a certain manner because they will feel extreme discomfort if they don't, or they'll think something bad's going to happen. Somebody with obsessive personality, take two. Somebody with obsessive compulsive, I know I didn't even clap in the frame.
All right, go ahead.
Take two. Obsessive compulsive personality disorder involves people who have those thoughts and think, yeah, things should be perfect.
It's everybody else that's the problem.
Right. Everybody else is crazy. Like if everyone else was doing it right, they'd do it as rigidly as I'm doing it, basically.
It would be something as simple as like a font size or a type of font that's used, for example.
Right.
Let's say in the work setting, somebody says it's 16 and somebody inputs the data at 14 or 15.5. And they aren't just like irked by it. They are like disturbed by it. And they will ensure and go to great lengths that doesn't happen again.
Right. Exactly. Well said.
That's
versus if somebody with OCD had a thought like, oh my gosh, I have to get that font has to be size 14. And if it's not, I'm going to feel off. So I'm going to have to go through and fix it all because otherwise I'm going to feel so uncomfortable that I won't be able to focus. Right. Like
it's a feeling. Yeah. It feels off.
Yeah. It's like, I don't like that. I don't want to, but it's not like, oh, I think that's the way that it should be done. There's almost
it's the world views.
Right. And there's a greater sense of insight in people with OCD about the reasonableness. Yes. And that's where it does sort of, in some instances, look like just right OCD.
Yes. And you can certainly see some crossover.
Mm-hmm.
You know, like we definitely have, folks who have OCD and OCPD. Not the ones that are trying to murder anybody, but that's a different diagnosis.
Yeah.
I didn't mean to go off the rails at the beginning.
I liked that, actually. I really did.
I mean, it is the best way, I think, to explain ego syntonic versus
No,
dystonic.
Absolutely. It's like whether or not you are aligned with and wanting to follow through. And it's something that comes up a lot in the discussion of OCD too, and what defines it.
However, OCPD is not related to that content.
No,
It's very much related to like.
Listen, there might be somebody with OCPD who wants to kill people. I don't know.
Oh,
but
I'm sure. Probably Dexter.
Oh my God, Dexter. Dexter.
Although,
such a good show.
Yeah, I don't know. He might have a crossover. It's not the same cluster. But anyways, moving on. OCPD can also have some criteria I know is related to finances. There can be a lot of hoarding of money.
Right.
Yep. Something like that. Or stingy. What's the language they use?
Oh, hold on. Let me look it up. Hold on. Because I know what you're talking about. Scrupulous. No, hold on. Miserly is the word that they use.
Miserly.
Adopts a miserly spending style toward both self and others.
Right.
Money is viewed. Hold on. Where'd I go? Money is viewed as something to be hoarded for future catastrophes.
Mm-hmm.
Right?
Right.
Very, very rigid. I feel like that's the word of this disorder, right? Is rigid.
Rigid to the max, dude.
Yeah. Yeah.
How therapist did I sound when I said dude?
Dude, the most therapist-y, dude. By the way, you did crushed it. I see that some people are asking about different OCD related things, and we do try to keep the questions related to the topic because people do come back and rewatch these. So we do talk about a lot of different themes and topics within OCD. If you check out some of our previous recordings on our Instagram TVs or on our YouTube page. And we're always open to suggestions about what topics get covered moving forward too.
Yep. Did you go over this is not a replacement for therapy?
This is not a replacement for therapy. It is for educational purposes only. Mm-hmm. I did not. So thank you for the reminder, friend. Somebody was asking about cluster B.
Okay.
So what is cluster B? Not to disturb the OCD talk because I do have that and I'm very interested in working through it. So cluster B actually doesn't even exist anymore. Fun story. But it is an artifact of the DSM-4. Or no, well, is it still? Hold on. No, I'm thinking about, what's her face?
What are we talking about?
Axis 1 versus Axis 2. That's what I'm thinking
about.
Yeah,
no, the clusters are still there.
They're still there.
Yeah.
No, totally. So would you like to talk about the clusters?
Yeah, I don't remember exactly what is in B and C, but I think C is like antisocial and borderline, and B is OCPD and schizoid, and right.
So here I have it. Cluster A personality disorders include paranoid, schizoid, and schizotypal.
Okay.
Cluster B is antisocial, borderline, histrionic, narcissistic.
That's right. I should have known that.
That's okay.
I am in that category. I am clearly a murderer.
So sure. Obviously, you're very manipulative. I've often thought that of you. And then cluster C is avoidant, dependent, or obsessive-compulsive personality disorders.
Okay.
Yep. There you go.
It's interesting that somebody on here asked about cluster B, though.
Right. Well, because I think you mentioned cluster B.
Well, I just said that's a different cluster.
Oh, right. Yeah.
Just interesting.
Yeah. Interesting. So,
also fun fact about personality disorders, you cannot diagnose them until the person is 18 years and older. So I definitely personally have had a client that meets full criteria, but I can't actually diagnose that. But treating the OCD can be rather tricky because it's going in line with like, well, is this OCD or is this how you feel like it must be and everyone else is wrong?
Right.
So we're going off the anxiety feeling almost, right? Like the just right versus, No, this is like, you guys are all idiots. Like, this is how this works.
Yeah, like what's wrong with you? If you were doing it right, it would look this way. Yes,
Right.
totally. Um, yeah. What was I going to say? In terms of personality disorders in general, too, um, in addition to being over the age of 18, generally we don't diagnose them right away because you have to see a pattern, like a prolonged pattern of behavior. And oftentimes that will take time within the context of therapy to become clear, right? So you wouldn't necessarily diagnose somebody with this right off the bat, but you would be watchful for it.
Right. Right.
Yeah.
And then I was going to say something and I forgot, but.
Them's the breaks. Oh, you got it.
Oh, I think I lost it again.
Freaking brains, man. Brains. They're the worst. So, does anyone have any questions about OCD versus obsessive compulsive personality disorder?
I feel like we were in a classroom just then, like we're professors.
Oh,
Does
yeah.
anyone have any questions?
Does anyone have
Raise
any
your
questions?
hands.
Oh, but they can. Well, no, they can't wave. They can wave. They can't raise their hands.
Right, right. I think you can in Zoom, right?
Yes, you can in Zoom. That's accurate, I think. Yeah, unfortunately, and the questions that we have aren't related, so we could take some other questions if you want.
Sure. Do you want to do like 5 minutes of it?
Let's do 5 minutes.
Okay.
Hold the phone. What happens to those anxiety OCD cases that are treatment resistant? Somebody asks.
Treatment resistant is a very strong language choice because there's a lot of factors that go into what treatment resistant actually is.
Yeah.
Some people think treatment resistant is just, well, go ahead, Lauren. I'm going to let you do this one.
It's a tough one. And I can totally appreciate where, you're weighing it out in your head because I feel like I'm doing the same. I don't think that people are inherently treatment resistant. And when we talk about it, it's interesting because we're talking about personality disorders, right? And
Right.
one of the, as a sort of side note, one of the problems I think with the idea of a personality disorder diagnosis, it speaks to the pervasiveness of the symptoms and the longevity of them. Mm-hmm. But it sort of insinuates that there's something inherently that's wrong with the person. Right, which I think is problematic. Right, yeah. Exactly. And I don't agree with that. And likewise, I think that this term treatment resistant often comes with this idea that if a person is treatment resistant or they are not, and if they are, then we have to look at things differently. Now, if we look at it as a sort of descriptor of your experience of treatment thus far, like certain treatments haven't been effective for you, then we might start looking at other options too. So we were actually just talking about this recently in one of our staff meetings. We were talking about TMS, which is recently, I think recently approved by the FDA. For the treatment of OCD. So that's not necessarily a first line treatment. It's not usually where people go. Exposure and ritual prevention is. SSRIs, although we're not doctors, that's usually where medical clinicians go first in terms of treating OCD. So if somebody is experiencing a harder time navigating treatment with some of the more standard methods, then we start to get creative and we start to introduce other things. And of course, there's also acceptance and commitment therapy, which it's, more and more, I think, integrated into first line treatments like ERP. But I don't think that there's one way. That's the thing. There's not. Right. This is what we do with treatment resistant people. And again, I have issue with that, but here are some options if this form of treatment isn't supporting you to the extent that might be beneficial for living your life.
Right. There's just so many, it's such a big question.
Yeah.
So it's hard for us to answer it like to what that person is specifically asking, because it could be that we totally missed the mark on even answering what they were
Yeah.
asking, right?
Yeah.
But yeah, I mean, I think there's so many factors to include here, which is, like you said, Lauren, is like, is the treatment appropriate for that person, right? Like, let's say this person has an eating disorder that's they're actively symptomatic. They also have OCD and maybe substance use that's active, right? We're not going to see them and pretend like we're going to put a Band-Aid over OCD and not address the other things. Like, that's
Right.
just not, that's a setup for them to fail. So in that case, you might see someone say like, oh, well, they're treatment resistant. Well, not at all, right? Like,
No.
we haven't ruled out anything yet.
Yeah.
There's a lot of factors involved in treating one person, which is why it's important to see someone who specializes in OCD, who is a therapist, because they will understand the layers involved and what steps need to happen.
Yeah, absolutely. And I think one of the points in what you were saying that is really important is that I think a better way of saying treatment resistant is the person may need more support. Not that they're, I don't know. I just don't like the term treatment resistant. It insinuates being, incapable or something versus, you know what, maybe the thinking is a little bit more deeply entrenched, right? Like the sort of the belief in the thoughts, for instance. Maybe there's a little bit more cognitive fusion going on there. So maybe if you refer to a psychiatrist, they might start to look at other medications too that could be beneficial with that. It's just, we all need different levels of support. That's all. Insight. At different times. Yeah, insight is definitely a big part of it, for sure.
So to do a big wraparound with OCPD is that oftentimes with OCPD is the person doesn't think, again, that it's anyone else, that it's not them, that it's everyone else that's the problem. So for them to seek treatment, it's usually that it's somebody else pleading, right? Like a partner, or it's interrupted their job and they've lost a job because they're too rigid.
Right, because it can interfere with getting things done too. Right? Like sometimes people will be so perfectionistic about how they do things that they won't complete a task because they can't do it correctly.
Right. It's like interference with work, for sure. So you always want to look, when you're looking at motivation, right, for improving and getting that person to be more willing, is why are we here? Why are you here right now? And let's move towards those goals. And if we can't move towards those goals, then how do we need to pivot and readjust ourselves to the appropriate manner? And a lot of times, I think with OCPD, it's kind of like, this is as far as that person wants to go, despite the fact that even the therapist and other people are like, but maybe, I mean, it's like, that's as far as they want to go.
Yeah. That's true. It's true. Same with OCD though. Same with anything, right? Like, I can oftentimes see where it would be beneficial to take on certain exposures that people are like, you know what, I'm just not willing to go there. It's like, okay.
Right.
And not that that's fixed, right? Like that can change over time, that people can come back and say, okay, I'm ready to work on it now. That will often happen.
Right.
Yeah. Anything else?
I think we're good.
There was one other question, but I don't know. I think we kind of got, we're at our time, my friend.
Okay.
All right. Thanks for joining us.
Yeah, thanks for stopping by, and we look forward to seeing you soon.
Next week? Question mark?
I'm traveling. I didn't tell you because I booked my flight yesterday.
Good
but
for you.
we will see.
we'll keep you guys posted.
Yeah.
How about
We'll
that?
keep you posted.
All right.
Okay.
Bye.
Adios.